Hi, all of you. Welcome back with a new case-based discussion. Let's see the case now. A baby girl was chronically cranky, irritable, sweaty, and lethargic and demanded food frequently. A physical evaluation indicated an extended abdomen resulting in enlarged liver. Blood glucose, which was measured 1 hour after feeding, was 70 milligrams per deciliter. After 4 hours, when the child was exhibiting irritability and sweating, the heart rate increased and blood glucose was 40 milligrams per deciliter. Now, these symptoms were corrected by feeding. So, what do you think is the probable diagnosis? Yes, so wait for the answer. Just have a thought about the answer. Now, case 2, a 8-month-old infant presents with hypoglycemia. On examination, hepatomegaly was observed. Blood investigations revealed lactic acidosis, ketosis, xanthomas on the buttocks. So, what's the probable deficiency? What's the probable diagnosis, all of you? So, by now, you all would have come to a conclusion about the diagnosis. Yes? So, yes, it is right. It is von Gierke's disease. Yes, it's a von Gierke's disease. Now, what is von Gierke's disease? Let's now discuss few points that you have to definitely remember regarding von Gierke's disease. Now, it's a glycogen storage disorder, type 1 glycogen storage disorder. It's autosomal recessive inheritance. Now, it's due to deficiency of glucose 6 phosphatase. So, what is glucose 6 phosphatase? It's an enzyme which converts glucose 6 phosphate to glucose. So, when this enzyme is deficient, what happens? Glucose 6 phosphatase is not converted to glucose. So, there is decrease in glucose. So, think about which pathway does glucose 6 phosphatase catalyze. Glucose 6 phosphatase is the enzyme of two pathways which are glycogen breakdown, glycogenolysis, and also gluconeogenesis. Is it not? So, it is present in two pathways, gluconeogenesis and glycogenolysis. So, after a meal, your dietary glucose provides you with adequate blood glucose. After that, up to 6 to about 16 hours, liver glycogenolysis is the main source of blood glucose level. Is it not? After that, even after that, which pathway maintains blood glucose level? It is gluconeogenesis, which maintains blood glucose level after 16 hours to about 48 hours. So you need these two pathways for you to maintain adequate blood glucose level in case of fasting. So if this enzyme is deficient and when these two pathways cannot provide you with adequate glucose, you present with hypoglycemia. Yes, so and this is an enzyme of both glycogenolysis and gluconeogenesis. So that is the reason for hypoglycemia during fasting. Yes, it is fasting hypoglycemia that you observe in von Gierke's disease. Now, hypoglycemia does not respond to counter-regulatory hormone administration. So, what are the counter-regulatory hormones? Especially your glucagon. Yes, your glucagon, epinephrine, thyroxine, all of which will try to increase the blood glucose level. By which pathway? By enhancing gluconeogenesis, by enhancing glycogenolysis. But the enzyme is absent but the enzyme of these pathways, especially glucose 6 phosphatase, is absent. Is it not? So, even if you administer counter-regulatory hormones, the hypoglycemia will not be reverted. So your only stay is giving glucose. Yes, frequently feeding with glucose in these kind of patients. Now, what are the reasons for other symptoms? Now, glucose 6 phosphate, it's not converted to glucose. Now, what happens to the glucose 6 phosphate? It gets accumulated. Yes, glucose 6 phosphate gets accumulated. It enters into glycolysis. Yes, it enters into glycolysis. So what do you get out of glycolysis? It's pyruvate. Now, pyruvate after PDH complex, it forms acetyl-CoA. Yes, it forms acetyl-CoA. Now, excess pyruvate, these substrates also increase in circulation, increase in the cell. So, what happens? Excess pyruvate will form lactic acid. So, it also causes lactic acidosis. Yes. Now, excess acetyl-CoA is acetyl-CoA is a substrate of fatty acid synthesis, also cholesterol synthesis. Yes. So how is fatty acid stored? It's stored as triacylglycerol, and also it is necessary for cholesterol synthesis. Acetyl-CoA is necessary for cholesterol synthesis. So what happens? There is hypertriglyceridemia and hyperlipidemia. Yes, hypertriglyceridemia and hyperlipidemia. So there is lactic acidosis, there is hypertriglyceridemia and hyperlipidemia. Now, hyperlipidemia and hypertriglyceridemia are reasons for doll-like facies, yes, accumulation of fat in cheeks, and xanthomas, accumulation of lipids in the subcutaneous tissue is xanthoma. So the presentation with doll-like species in xanthomas, the reason is excess of acetyl-CoA, excess of pyruvate, which is due to the accumulated excess glucose 6-phosphate. Yes. Next, acetyl-CoA is also necessary for ketone body synthesis. So accumulated acetyl-CoA can also form ketone bodies. So it enhances or it increases ketosis. Yes, it increases ketosis. Also, glucose 6-phosphate, excess glucose 6-phosphate will be diverted to HMP shunt pathway. Yes, it's also a substrate for HMP shunt pathway. So this excess diversion into HMP shunt pathway, then more of pentoses are formed, more of ribose 5-phosphate is formed, then more of furin synthesis occurs. So what is the end product of furin synthesis? This is uric acid. So there is hyperuricemia also in von Gierke's disease. And glycogen deposition in the liver, excess glycogen deposition in the liver will lead to enlarged liver, which is hepatomegaly. So they're also prone for developing liver cirrhosis. So these are the manifestations of von Gierke's disease. Yes, what are the manifestations? One is fasting hypoglycemia. The hypoglycemia does not respond to counter-regulatory administration. Then it is responsible for causing lactic acidosis, hyperlipidemia, hypertriglyceridemia. So which is the reason for doll-like facies and xanthomas. Also, it causes ketosis, hyperuricemia, hepatomegaly. Yes. Now, do you understand the biochemical basis of various symptoms in von Gierke's disease? Yes. So, how do you treat this? You treat it with frequent feeding with slowly digested carbohydrates. Example is uncooked starch, nasogastric drip feeding at night. Yes. So, you don't allow the fasting pathways to get stimulated. Instead, you frequently feed the child with slowly digested carbohydrates. Yes. So with this, we complete the discussion of von Gierke's disease. So let me meet you again with another case. Thank you all.